Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Did you know that weather plays a big part of cold sore development? I want to talk about this in some detail today because we certainly know that with cold and flu season upon us and harsher winter weather, including the more dry air and the wind that is generally heightened during the winter months, this actually can make the body more hospitable to the virus that causes cold sores. So I want to talk about the herpes family of viruses, talk about cold sores, what you can be doing about that, as well as touch on shingles as well. So I am Amanda Williams, MD, MPH, and I want to discuss what it is that a cold sore is. And we know that roughly 50 to 80%, and that may seem like a wide range, but we know that it's pretty darn common in terms of the percentage of the U.S. population that has herpes simplex 1. So we're looking at the herpes virus and then simplex 1, and this is the one that is causative to creating cold sores. So what we know is that generally speaking, when people get a cold sore, this usually falls into a category of a few different factors that come into play. First, we always have to look at the immune system and what is actually occurring in the body at the time that that cold sore develops. Are we currently ill with something such as the common cold and we're trying to fight that off? And because of that, the body's at a heightened state of stress, which can create this reactivation of herpes simplex 1. And this is generally speaking what happens. Now we can also look at shingles, and we know that shingles is directly correlated to that weakened immune system and the higher stress situations that can create the reactivation of the chickenpox virus, which is varicella zoster. So we know that the varicella zoster is the causative agent to chickenpox when we're younger and shingles later in life, and they are both part of the herpes viridae family of viruses. So when we look at herpes simplex 1 and we look at shingles, we know that they fall into that same viral family. Now, the way that they present can be slightly different, but we definitely know lowered immunity and stress are the driving cause for both of those to actually come out. Now, let's talk first a little bit about the impact that a cold sore can have. And anyone who's dealt with a cold sore knows that it's not a fun experience. It can be incredibly painful. It's certainly not the prettiest thing to look at when someone has a cold sore on their lip and it blisters up and you get the leakage of the fluid and it can be painful. So all of these things that we know go along with the herpes simplex 1 virus. So we have to make sure that we are doing what we can to support our immune system. Now, we know that the common cold and influenza are common drivers for the reactivation of that, because if you have, a fever, if you have, runny nose, any of the things that go along with the common cold or influenza certainly are leaving the immune system more open and prone to allowing herpes simplex 1 to reactivate itself and create that lovely little cold sore. So we know weather plays a role into it. We know stress certainly does. We know that the immune system being disrupted is going to play a significant role. But we also can see how certain nutrients and the lack thereof can also lead to a greater likelihood for herpes simplex 1 in particular. And we can look at low vitamin C intake, we can look at low vitamin D intake, we can certainly look at low zinc intake. And we know that all of those three, the zinc, vitamin D, and vitamin C, are common for Americans to not have a adequate amount of. So being in more of an insufficient state when it comes to your intake of those key vitamins as well as the mineral zinc. So this would make sense that we would turn towards something like the Immunity HX formulation that contains those three in combination. It has that vitamin C, it has the vitamin D along with the zinc. So during cold and flu season, quite advantageous to make sure that we are bolstering up our system with higher amounts of those three things in particular. We can also look at mushroom extracts. We can look at the amino acid lysine. We know that this is very important for not only when we look at cold sores, but also when we think about shingles, because what we know about those herpes viruses is that they rely heavily on arginine. So if we take higher levels of lysine, that helps to offset that replication process. And many studies have been done. And what's really interesting is many of the initial studies done with lysine were all the way back in the 80s. There was a study done in 1987, and it was published in the Dermatological Journal back then, looking at the success of lysine therapy in the recurrent herpes simplex infections and how it should be utilized as a treatment, but as well as a treatment, it should be used as a prophylactic. So for those who are dealing with recurrent herpes simplex 1, and I'll even throw herpes simplex 2 into this category too. Herpes simplex 2 is what we think more of the sexually transmitted form of the herpes virus. We know from the studies all the way back in the 80s that oral lysine intake, so taking that amino acid at higher levels, somewhere in the 2,000 milligram per day range, is very effective when it comes to the reduction of the occurrence, the severity, as well as the healing time for those herpes outbreaks. So lysine, hands down, we definitely know. So we can look at all the different herpes viruses and we can kind of clump them all together and say, yes, lysine is something that we should be incorporating in. Then we look at the role of vitamin C, and really interesting research out there as far as how vitamin C can be beneficial to those who have outbreaks of herpes as well as shingles. And they're finding that the vitamin C is not only able to help in terms of the healing process of that, but also for the pain management of this, which is why I think it's really touted right now with current research as having this ability for a treatment for pain. And oftentimes you don't think about vitamin C in that realm at all. You don't think about vitamin C and, oh, hey, this could be good for a pain, reliever. You don't think of it like an NSAID. But they recognize that vitamin C insufficiencies certainly are a driving force for lowering that immune system, taking longer to heal, all of those things that go along with those outbreaks of things like herpes simplex 1, 2, as well as shingles. So in these studies, what they were able to show was that higher levels of vitamin C in terms of supplementation actually enhanced the body's ability to fight off those viruses, but also at the same time, it lessened the pain, which is really very, very interesting. And they said vitamin C appears to be this safe and effective adjuvant therapy for acute and chronic pain. So this is, once again, one of those things where you think of a vitamin for one thing, and then you realize it does so many other things. So statistically speaking, we know that when it comes to cold sores or when it comes to shingles, this is actually very common. And we recognize that estimate, somewhere between that 50 and 80% of the U.S. population has been exposed to herpes simplex 1, as well as we look at that exposure to chickenpox. So for those who have had chickenpox as a child, that virus never technically goes away. So when we're thinking about varicella zoster, it actually remains dormant and it lives within the dorsal ganglion within the nervous system. And when we get older in life, generally, this is kind of the pattern for shingles. As you get older and say something comes up, maybe you come down with the common cold, maybe you're just highly stressed out. There's a lot of different driving forces as to why someone could then have a shingles outbreak. Now, shingles outbreaks are really very painful if you've talked to anyone who has experienced this. So you think the cold sore on your lip creates, discomfort for you. Just try and go around with shingles, and then you really can see where that pain level can be exacerbated. And the problem with shingles is the length and time of which it causes pain and how long that lingers afterwards. So there's this post-herpetic neuralgia that can occur, which can last for 3-4 months after someone has the initial shingles outbreak. So it's a big issue. I wanted to talk about this. I'm not going to get too heavy into the science about how these different herpes viruses are working and the replication process, but what I do want to zero in on is the nutrients that you can be utilizing. So I had mentioned the importance of making sure that we've got vitamin C, zinc, and vitamin D on board. But we also want to think about other nutrients that certainly can be beneficial when it comes to boosting up our immune defenses. So we think about things such as probiotics. Definitely would be advantageous during cold and flu season to make sure that we are maintaining a healthy microbiome. So taking something like the probiotic HX, which is that multi-strained probiotic, would certainly be advantageous. Then we can look at the mushroom HX formulation. Scientific studies have shown that the mushrooms, reishi mushroom in particular, is very, very targeted when it comes to that herpes family of viruses. So this is another area where, say during cold and flu season, it may be wise to say, what else can I be taking? Hey, let's look at that mushroom formulation and really allow for our immune system to have this added layer of protection in a sense. And we can see the science behind how the mushroom extracts are working on multiple different mechanisms within our immune system to really promote a healthy immune system response against different viruses, bacteria, as well as funguses. But in this setting, we're definitely zeroing in on the herpes viruses. So a lot of different ways in which we can incorporate these nutrients. We can incorporate lysine in. So if someone has a cold sore, one of the best things to consider doing is taking higher dose lysine, maybe 2,000 to 4,000 milligrams of lysine for a good probably 7 days to make sure that we are really deactivating that replication process of that virus, making sure that we are taking adequate amounts of vitamin C. How much vitamin C? I would say 1,000 milligrams 2 to 3 times per day. Vitamin D. How much vitamin D? It really depends on your serum blood levels, but somewhere probably in the range of 1,000 international units to 5,000 international units per day. And then we look at zinc, and at minimum 20 milligrams of zinc per day, ideally around 30 milligrams of zinc. So many different options when it comes to targeting those pesky little cold sores. And one of the best things that you can do is going into cold and flu season is get ahead of the game by supporting the immune system, making sure that you're taking those nutrients well before you are ever exposed to the common cold. So you have a better likelihood that if you do get infected with it, it's not going to have as much of an impact or make you feel as symptomatic, and at the same time, that should really minimize that potential for the reactivation of herpes simplex 1, or if we are even thinking, further down the road, looking at the varicella zoster virus, the reactivation of that, which would then create shingles. So kind of a lot of information, but I just wanted to put that out there since it is cold and flu season, and I know a lot of people have those concerns, and so this is just kind of a how-to guide as to lowering the potential for cold sores to take you on during those cold winter months. So I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Now, do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health, and we will see you next time for another episode of the Invite Health podcast.